Okay, you ready? On behalf, Delma, are you ready for me to start? Yes. On behalf of our chairman, Mr. Tommy Dortch, we would like to first of all say thank you to each and every one of the leaders, the members, the delegates, and the presidents of each chapter. We want to thank our partners at the Morehouse School of Medicine and the National COVID-19 Resiliency Network for their partnership in this grand endeavor. But we would like to thank our sponsor, Pfizer, for supporting us through these very challenging times. We would like to welcome our special guest, Ms. Naisha Foster, who is the Vice President of Product Access and Global Health and Patient Access for Pfizer, and she has a message for you. So, Ms. Foster, thank you.
Thank you, Dr. Danner. It's a pleasure to be here today representing Pfizer. Moreover, it's an honor for our company to be partners with 100 Black Men of America. Today, I want to give a brief update, an overview of one of our very important access programs here in the US called Pfizer Rx Pathways. Via Pfizer Rx Pathways, we get to live our mission and our purpose, which is to ensure breakthroughs that change patients' lives and to ensure that any medicine that is delivered by our scientists actually gets to the most vulnerable of all populations. Next slide, please. Today, I will go over just 3 key points in the agenda. One, helping us all understand what access needs are still there for the uninsured and underinsured populations. Give you an understanding of how Pfizer Rx Pathways helps. And then I'll turn it back over to Dr. Danner. Next slide. So these data that are shown here tell us a little bit around uninsured rates in the US. While insurance coverage has certainly improved in the US, we know, given these rates, 10% overall in the US are still uninsured. And when you break it down by ethnicity, we see those disparities are even greater. With these data from June of this year, we see that African Americans, Hispanics, and Asian American Indians, Alaskan Natives are more than double in some instances, more than the national average. And what that says to us is that there is still a need for people to get the help that they need to afford medicines. Next slide, thank you. And while there are many who are uninsured, even those who have insurance coverage still have issues affording their medications. This slide here talks about those who are underinsured, and underinsured has many definitions. But overall, 45% of US adults aged 19 to 64 are inadequately insured. More than a quarter of people who have employer plans and more than 2 in 5 with marketplace plans are still unable to afford their medicines. The coverage is inadequate for these individuals as well. And what we know from research is that when people can't afford access to their medicines, that leads to health disparities, and we are not able to achieve health equity. Next slide. Pfizer's commitment in the US is vast. We've had this program called Pfizer Rx Pathways in many shapes and forms for over 30 years. Pfizer Rx Pathways basically connects eligible patients to a range of assistance offerings, either helping patients understand their insurance, helping them get access to copay support where available, and ultimately, if none of that works, to see if they're eligible for medicines for free or at a savings. We have dedicated resources to help people understand how they may be eligible, including our medicine access counselors who help each person understand their unique needs for our programs. Next slide. And it's rather simple to get started in our program. You can either call our call center at 1-844-989-7284, or you can visit our website, www.pfizerrxpathways.com. There, either in speaking to someone or online, just answer 4 simple questions to help us understand your unique financial needs. Those questions include what Pfizer medicine you have been prescribed, what type of prescription coverage you have, how many people are in your household, and your total household income. Once we have that understanding and we direct you accordingly, the medicine access counselor will review your results, and then you and your physician would need to complete a few short forms to send back to us. In addition to our call-in number, in addition to being able to fax and mail your application to us, earlier this year in April, coincidentally in line with the pandemic, we launched an online portal called PACConnect. PACConnect allows patients and HCPs to interact with our Pfizer Patient Assistance Program for many of our most commonly primary care medicines. And it's so easy, right? You can track your Amazon package, but we thought, why shouldn't people be able to apply for our program online 24 hours a day? And if they're eligible and they get their medicine through the program, they should also be able to track their medicine shipments as well. And that's exactly what PACConnect allows you to do, either via your phone or your tablet or your computer. Next slide. Thank you. So this slide here, not meant to be fully digestible, but what I want you to understand is once you answer those questions, these are the range of offerings that we want you, that may be eligible for patients. First is the Patient Assistance Program. So that's where either at your physician's office or shipped through mail, you may be able to receive a free product through that program. We also partner not just with individual offices, but we also partner with federally qualified health centers, free clinics, disproportionate share hospitals to provide our product for free to the uninsured population. So again, a script is necessary, of course, but in your local clinic, you can ask them whether or not they're part of Pfizer's institutional patient assistance program, where uninsured patients can get access to free medicines. And maybe I'll just hit on one more in this slide. We also have special hubs. Back one slide, please. Back. Yes, thank you. We also have treatment-specific patient support hubs. And what that means is that we recognize for oncology medicines and specialty medicines, it's not just a matter of getting the prescription, but there are other questions that you may have, other support services that this patient population may need. And so in addition to potentially getting free medicines, you can speak to a specialized counselor who can help you navigate your health insurance coverage or get other specialized services as needed. Next slide, thank you. Our online resources extend beyond how you may get access to our product, but they also help you understand all of these patient assistance options that I just laid out for you. We also provide free educational materials and understanding that, this is not just about Pfizer, but we want to be a full service option to patients everywhere. We also have national and state healthcare resources on the site. Next. And then lastly, we also connect patients to valuable industry programs. And so if you need to know more about accessing products that are not just Pfizer products, you can come to Pfizer Rx Pathways and go to any one of these 3 options here. Each of them provide different services. So the medicine assistance tool is managed by PhRMA, the Industry Trade Association, who makes available, basically they aggregate all the patient assistance programs from the various manufacturers so you can put your product into their system and they will direct you to a sponsor or a manufacturer's program that may be right for you. There are also links there for RX Outreach, which is a nonprofit charitable organization that provides eligible patients with access to more than 500 medicines at an affordable cost. And Needy Meds is a similar service. So I always make this plea at this part of my presentation to say, all of the manufacturers, I feel confident in saying, want to make sure that people access their medicines. If ever something appears not to be affordable, find out who the manufacturer is, do a little bit of legwork looking on these sites, because there could be financial assistance available to you. Next slide. As I said, Pfizer has been ensuring that patients in the US get access to our medicines for 30 years. We are proud when we get calls from people who say, without you, I may not have taken my medicine. They thank us for our kindness and our understanding and hearing their unique situations out. In the last 5 years, we've been able to help more than 1.2 million patients access over 8 million Pfizer prescriptions for free or at a savings. And that's just a little bit about this program here today. I know you have a wonderful program ahead of you on COVID-19 and vaccines that are available. And I will turn it over now to Dr. Danner to pick it up from here. Thank you.
And thank you, Ms. Foster, and we really sincerely appreciate it. So on behalf of our chairman, Tommy Dorch, and our chair of the Health and Wellness Committee, Dr. Mark Alexander, I want to say thank you to you for presenting to our members, and I want to thank you for Pfizer and all that you guys have done. But my name is Dr. Omar Danner. I am a professor of surgery and critical care at the Morehouse School of Medicine, and I am the chair of our Healthcare 2.0 initiative, as well as the COVID-19 Pandemic Action Group for the 100 Black Men of America. I would like to welcome each and every one of you and welcome our distinguished guest. We're going to today give you an update on COVID-19 testing, therapeutics, and vaccines. And during this webinar, our expert panel consisting of Dr. Mesfin Francois and Dr. Obina Naidu will give you the latest recommendations related to COVID-19 testing and prevention, as well as debate current FDA-approved therapeutic interventions. In addition, we will provide an appraisal of the most recent data from the vaccine trials and projected rollout dates and strategies for our National Vaccine Administration Plan, some of you may know as Operation Warp Speed. And this is being administered through the Department of Health and Human Services. So I'm going to take a second and I'm going to let our guests, our panelists, our specialists introduce themselves, and then we'll have a short presentation and then we'll have a discussion. But first, I'd like Dr. Naidu, could you please introduce yourself?
Yes, thank you very much. My name is Dr. Obi Naidu. I'm an infectious disease physician at Ocean Clinic Foundation here in New Orleans, Louisiana. I'm the program director for the Infectious Diseases Fellowship Program. And I've provided some, I was part of a group that provided some, served in an advisory role for the COVID-19 vaccines trial group. And I'm very, very happy and honored to be here with you guys, and I hope I'm able to address some questions and concerns that you all might have.
Thank you, Dr. Naidu. Dr. Francois is also a colleague and a longtime friend and faculty member at the Morehouse School of Medicine. Dr. Francois?
My name is Dr. Francois. I am infectious disease physician. I'm a professor at Morehouse School of Medicine. I serve as a consultant in infectious diseases, mainly at Grady Hospital, but I also see private clinic patients at Morehouse Healthcare. I have been here for about 18 years at Grade in Atlanta, and I am happy to be invited to participate in this discussion.
Thank you. So may we have the first slide? So again, I want to thank each and every one of you for being on this panel discussion, and thank Ms. Foster for kicking this off. I think this is a very important time as we're still in the midst of a very serious pandemic. And, you know, there are a lot of people who have been getting sick and ill. So I just want to give a quick update on where we are as it relates to the pandemic. And then let's talk about what are things that we can do. And then hopefully we can provide some information that will be useful to you at a very practical level as you're making your decisions, whether you take the vaccine, you know, what tests should we get, and what should we do? Next slide. As it stands currently, there are over 64,664,000 people who have been infected worldwide. There's now over 1.46 million people who have died since the pandemic has started. Next slide. In the United States alone, we have now surpassed and are about to surpass 14 million infected and over 273,000 people infected. Actually, who have died thus far from this pandemic. Yesterday alone, there were over 2,800 deaths due to this coronavirus infection, and these numbers, as far as the number of people infected and the number of deaths, continue to rise. Next slide. One of the reasons that we're here is we know that this pandemic, this virus, has caused a disproportionate impact on the communities of color, particularly African Americans, Black Americans, and Black people throughout this world. As it still stands, there's approximately 2.5 to 2.6 times higher chance of dying from this COVID-19 infection. However, when you look at the total numbers, because African Americans make up a smaller population, we do not make up the largest number of people, but as a subgroup, we make up the highest percentage of people who have a very unfavorable outcome. So it's inherent that we protect ourselves by following guidelines and doing everything we can. So what we hope to do is to be able to provide you information which will help you to guide or navigate through this pandemic. Next slide. And so the pharmaceutical companies, as Ms. Foster has said, has been working very diligently trying to find solutions to help us address this dreaded pandemic. And currently, there are some FDA-approved treatments that are coming online, but they remain limited, and we'll talk about this by our experts. In addition, vaccines will hopefully be available for administration sometime either this month or early next month. And we will get more information on this from our expert panel. But that being said, prevention remains the most effective strategy. So regardless of what medication pharmacotherapeutics become available, we still need to do the basics: wearing our masks, practicing social distancing, practicing good hand hygienes. And other things that can be done that you could do on your own is optimizing your immune health by eating healthy, by exercising, by taking immune enhancement supplements such as vitamin D, zinc supplementation, multivitamin, and turmeric. And lastly, engaging in a practice in a program of self-monitoring at the 100blackmen.org's website. If you go to Healthcare 2.0 and download the Mimi Rx platform, it provides you a mechanism for self-monitoring for management and surveillance of COVID-19, as well as the management of chronic disease. Next slide. And this right here is just a quick snapshot of our immune enhancement strategy, which gives you the opportunity to do something rather than basically staying at home in place if you do get infected. But even before then, an ounce of prevention is worth a pound of cure. So here's our general regimen, particularly for the 100 Black Men members and their sphere of influence, which includes vitamin D loading dose of 50,000 units and 10,000 units a day. There's a lot of information that's saying that getting your vitamin D level checked and making sure your level is greater than 30. This is to push your level up over 30 to 40 to closer to a normal range. Zinc supplementation to slow down viral replication at usually about 50 milligrams of zinc sulfate a day. Codees can be taken as an alternative. It has 13.3 milligrams in it, and this means that you have to take it about 4 times a day for equivalent dosing. Elderberry with zinc can be taken once or twice a day, and that may be helpful as well. And lastly, just taking a multivitamin to make up any deficits in your diet, as well as if you do have either inflammation, arthritis, or something like that, or just for general health, turmeric is a good anti-inflammatory agent and good antioxidant. So just for general protection, this is just one strategy. Next slide. But it's very important that you get your exercise. Our current recommendations is trying to get 10,000 steps a day or exercising 3 to 5 times a week, at least 30 minutes a day, which comes to 90 to 150 minutes a week. Learn to manage your stress in a healthy manner. Try to really socialize. Don't get isolated and don't not talk to people. Please continue to communicate, and then get a minimum of 6 to 8 hours of sleep each night. Next slide. So for more information, please visit our website at 100blackmen.org/healthcare2-0, and or just go to the website and wait till you see the flash for the Healthcare 2.0 in order to access the information page. You also can get information from the National COVID Resiliency Network site at www.msm.edu/NCRN, as well as the websites that Ms. Foster shared. There's also a lot of information available on our cdc.gov website /COVID-19, as well as if you're looking for vaccine information at the www.hhs.gov, the website for the Department of Health and Human Services. But that being said, I'd like to turn things over to our panel experts, and they're both going to give a presentation, and then we'll have an interactive discussion. Thank you. So Dr. Naidu or Dr. Francois, whichever one is welcome to go first.
Sure. Good evening, everyone. I'd be happy to just provide a quick overview of where we are as far as vaccines. And if my slides may be loaded. All right, thank you very much. Next slide. I just wanted to kind of give everyone an update. This is data from CDC's webpage that I pulled this morning. Over 13 million cases in the US, total deaths over 269,000. We're more than likely gonna push past 300,000 deaths by the end of this year if things keep going the way they're going. So we're still in the middle of it. Yes, there's promising information as far as vaccines, but we're still in the thick of it and we still need to exercise precautions. Next slide. So in terms of exercise and precautions, social distancing, and again, social distancing means, you know, obviously 6 feet apart, but as was alluded to, you know, you can still talk to people over the phone and kind of communicate. You know, you don't want to be completely isolated. That's certainly very hard on people's mental health. Wearing masks has time and time again. There's a ton of data out there showing that wearing masks is in fact protective. So please, please, please wear masks and speak to people out there to mask up. Hand washing. And then I'll focus a little more on vaccines. Next slide. Uh, uh, tap down, keep going, and keep going. So these are all the different vaccine platforms that are available: live vaccines, recombinant vaccines, inactivated vaccines, protein subunit vaccines. And so these strategies are also being used to develop vaccines as far as COVID is concerned. Now, the two vaccines that we have early data on are mRNA vaccines. This is a new platform as far as vaccines, but it's certainly been available for quite some time now. Next slide. Let me, if I may just answer this question real quick. When people get vaccinated, will the person be recommended wearing a mask until they get a second dose, or for how long afterwards? If I can just quickly answer this question, and because I think it is very key question here. So even as the vaccines roll out, everyone is still going to need to keep wearing masks. You know, the determination for when masks and social distancing will be stopped will be made based on community transmission. And so people certainly need to even with the vaccines being rolling out, everyone is still going to need to wear masks until transmission is down to a sufficient enough level where our expert colleagues at CDC feel is no longer necessary. When the person is vaccinated, how long after the second dose will they? Yeah, I think I spoke to that. Masks will continue to be worn for the foreseeable future until we get transmission down to a reasonable level. And so we're still looking at several months of mask wearing. Even as vaccines are rolling out, we'll still be wearing masks. I want to make that very clear. And the CDC has tried to put this information on their webpage too, that we'll still be wearing masks. Great questions. And so this slide is just showing the qualities of an effective vaccine, and these are things that the FDA will be considering in terms of looking at these new vaccines. Ideally, you want a vaccine that lasts a long period of time. You want a vaccine that's effective. You want a vaccine that's safe, meaning that it doesn't cause too many side effects. And you want a vaccine that's easy to store and ultimately transmit. And so, as providers, as infectious disease doctors, as physicians, these are things that we sort of look for. Next slide. So I showed this slide just to point out that there are multiple stages in vaccine development. It starts off in the lab, then it goes into animals where the vaccines are tested in animals, usually primates, because they're somewhat similar to humans. And there's some safety information that's obtained in terms of were there any bad effects. If there were any bad effects on the primates, it doesn't make it past that. It stops there, and you have to start from ground zero again. Assuming it makes it through all that way, then you get to the clinical development stage. And in clinical development, it goes through phase 1, phase 2, and then phase 3 trials. Phase 1 is to just see if it's safe in a small number of people. Phase 2 is to make sure it's safe and to make sure it actually stimulates the immune system. And then phase 3 is a larger trial where you try to see if it's actually effective, and you also collect safety information as well. So you're collecting safety information each step of the way, and in phase 3 trials, you're trying to see if it's effective. So I showed this just to show there's a lot of concern about the speed of how things have moved. Things are moving quickly, but they followed each step from development in the lab to initial tests on animal models to phase 1, phase 2, and now we're in phase 3 trials for most of the vaccine candidates. And after you have your data from phase 3 trials, then you go to the FDA. The FDA takes its time. The FDA actually collects the data from your trial. the FDA does its own analysis on the data to make sure that it is in fact effective and it is in fact safe. And then based on that, the FDA now says, hey, this is okay to be disseminated for human use. Next slide. So I just showed this to show that there are 6 vaccine candidates that are in trials in the US in various stages. There is one in Russia, and which I didn't include in this slide. The Russian vaccine apparently has some good data based on what the scientists are saying there. But these are the ones that are in trials here in the US: Pfizer, Moderna, AstraZeneca, Janssen, Novavax, and Sanofi. And we have some early data from Pfizer and Moderna. There is some data on AstraZeneca, and I didn't go into too much detail in these slides about the AstraZeneca data. But we'll talk a little bit about the Pfizer and the Moderna. Next slide. So the Pfizer, so this is Pfizer in the US, and then BioNTech in Germany. They recruited a number of participants, over 40,000. It's a 2-dose strategy. You get 1 dose, and then 3 weeks later, you get the second dose. And what they were looking at is some interim analysis based on the number of cases, as well as people who've been followed at least for 7 days after the second dose, which accounts for basically 28 days after the first dose. So roughly about a month after they got their first dose. We have this interim analysis, and based on this analysis, what they essentially found were that there were 162 cases of COVID in the placebo group, so in the group that did not get vaccine. As compared to the group that did get vaccine, there were only 8 cases. And that translated to a vaccine efficacy of 95%. And I just want to point out that that's a very good vaccine efficacy. Most of our really good vaccines have efficacies of around 90% or so. And so, you know, that's why there was a lot of buzz about this, and that's why this was kind of exciting. Now, what we don't know is how long this protection lasts. And so these individuals are going to continue being followed for at least 2 years in order to get some sense of how long, you know, the efficacy lasts. Next slide. So there were 10 cases of severe COVID that were recorded. 9 were in the group that didn't get the vaccine, and so only 1 was in the group that did get the vaccine. And as everyone has heard, the Pfizer vaccine does need to be stored at frozen temperatures. And when you're ready to use it, you bring it out, it thaws, and then you use it fairly immediately. Next slide. I wanted to talk a little bit about the Moderna vaccine. Again, this underwent interim analysis, and I just want to be clear that the people doing the interim analysis are not the pharmaceutical company. This is an independent group that the NIH has put together, independent of the pharmaceutical companies, that does this interim analysis while the study is ongoing to provide us with this data. And what they found in this Moderna trial was that there were about 95 total cases of COVID recorded. 90 were in the group that did not receive the vaccine, and only 5 were in the group that did receive the vaccine. And this meant a vaccine efficacy of about 94.5%. Again, this is phenomenal vaccine efficacy. When you think about measles, mumps, rubella, which is one of our better vaccines, you're looking at around 85 to 90%. And so again, this is really good. We know that early on, it appears to provide some protection. And again, these individuals will be followed longer term to see how long that protection lasts. Next slide. And I think what was somewhat exciting, again, this is really early information, was that none of the people who got the vaccine got severe COVID. So the cases of severe COVID in this Moderna trial were all in the group that got the placebo. And for the Moderna vaccine, it needs to be stored, it needs to be frozen but it can actually stay in a regular refrigerator for up to 4 weeks. And so in terms of its use and transportation and that sort of thing, it may be a little bit more easier in terms of the logistics as compared to the Pfizer vaccine. Next slide. So adverse events. So the question always is, we have some data showing that the vaccines are effective, at least in short-term follow-up. And then the other thing is, are they safe? And so adverse events are sort of graded as really mild all the way to like kind of severe, which would be grade 5. So there were no severe adverse effects in any of the trials. There was nothing life-threatening or nothing that caused death. There was a small amount of grade 3 adverse events. Next slide. And so in terms of the Pfizer vaccine, close to 4% reported some fatigue, around 2% reported headaches. For the Moderna, close to 3% had some pain where that needle went into their shoulders. Close to 10% had some fatigue, some muscle pain, joint pain, headaches. All of these grade 3 events were short-term, meaning that they didn't last for more than a day. And these numbers, if you think about the flu shot, a small proportion of people who get the flu shot, a very tiny proportion, have symptoms not too different from this, but usually not lasting for more than 24 hours. Let's see, that should be my last slide. So actually I have one more. Just a quick update. The FDA will be meeting in terms of the Pfizer vaccine to review it and make a decision as to whether or not it's approved. They'll meet on December 10th. Just want to be clear that no vaccine has been approved yet. We have data that's encouraging, but the FDA will meet on December the 10th for Pfizer. I didn't include it here, but the FDA will meet on December the 17th for the Moderna vaccine, so roughly about a week after. And assuming that these are approved, and we'll have to see, but assuming that they are approved, there are some guidance, because right now there's a limited number of doses from the Advisory Committee on Immunization Practices, which is the ACIP. This is the national committee that provides recommendations for all vaccines that we get. And so they've made some statements about the initial supply of vaccines going to frontline workers and to elderly individuals living in long-term care facilities. As we know, those individuals have been hardest hit so far by this pandemic. And so I'm going to end and hand off to my colleague.
Excellent. So, Dr. Francois.
Okay. While waiting for the slides to be loaded, I just want to start by saying that as far as treatment, we don't have very effective treatment. There are some drugs that have been approved, but at this point, really, there are no great therapeutic agents. So still, wearing masks, social distancing, washing hands, and so on. The prevention is what needs to be emphasized here. Can I have the slides? Are they being loaded? Okay, next slide. So this is a slide that Dr. Omar has already discussed, basically showing the current state of how the virus is spreading, the number of patients. The only thing really I can highlight here, I don't want you to click it, is the positivity rate in the United States is very high, and the WHO recommends that if a country is doing enough testing, among the people who are tested for the virus, no more than 5% should be positive. But in the United States, we see as as many as 40% positivity rate in some states. For example, South Dakota. In our state, for example, in Georgia, it is close to 20%. So we're not doing near enough testing as recommended by the WHO. And of course, if you don't know who is infected, it makes it that much more harder to control the spread. Next slide. So this is also basically a slide that has been already covered a little bit, but basically the virus spreads through mainly respiratory droplets when somebody coughs and sneezes, and those droplets land on another person's mouth or nose. That's kind of how the virus is transmitted. But also the other thing that makes this virus difficult to control is people who don't have any symptoms can transmit the virus to others. Next slide. So while the main mode of transmission is through droplet, in some confined settings, the transmission can be airborne. For example, in a room, a confined room, or such as elevators, or in churches, for example, when there is singing and so on. In those settings, it has been shown to spread through airborne. That means these droplets can hang around on the air and cause widespread transmission. We call some of these super spreader events that you hear about in the news. But a limited transmission also occurs when you touch a surface and touch your nose or mouth, for example, doorknobs or elevator buttons that high touch surfaces that when you interact with people. Next slide. So in terms of protection, this has been already highlighted. Basically, washing hands or with soap and water, or using, for example, alcohol sanitizers with 60% alcohol. Avoid touching eyes, nose, and these mucosal surfaces with unwashed hands. Avoid close contacts, meaning if somebody is infected at home, somebody has a disease at home, again, maintaining social distancing. Also, when you go out, wearing masks and staying 6 feet apart from others who you don't live with, and covering your nose and mouth with masks. I see just a comment on mask wearing. I see sometimes outside people wearing the mask on their chin or only covering their mouth or nose. The proper way of really wearing mask is it has to seal and cover both the mouth and nose. That's really the better way, the intended way to protect oneself from infection. Next slide. Okay, I think I talked about this. Next slide. So this is basically just a schematic representation of the virus. I only show this slide to say that this is the spike protein that you hear about. This is the structure that the virus uses to attach to host cell receptor, human cell receptor, and gain access to our cells. And this is the virus's nucleic acid. These are important structures. And the other, the main reason that the virus causes so much, illness and death is because our immune system, trying to fight the virus, produces this inflammatory chemicals called cytokines. That's really what does the most damage. These are some of the treatments I'm going to talk about, target some of this structure. That's why I'm mentioning this here. Next slide. So in terms of testing, the two tests that have been approved by the FDA to diagnose a person who has infection is the nucleic acid test, meaning the PCR of the virus, and the antigen test. Those are the two tests that are recommended. FDA doesn't recommend the antibody test to diagnose the infection that is used for epidemiological purposes to determine prevalence. But the two tests that are recommended are the nucleic acid and the antigen test. Among those two, the nucleic acid test is the best test. The antigen test tends to be a little bit less sensitive. Next slide. So this is the in hospitalized patients, the NIH panel recommend this treatment for hospitalized patients who are seriously ill or on a ventilator with this medication. There are two drugs that have been one is approved recently, remdesivir. This drug basically blocks the virus from replicating, so it acts on inhibiting the RNA replication. That is its mechanism. And the other drug that has been around for a long time is called dexamethasone. It is a steroid. Basically, what it does is it dampens down the immune response. Remember, I talked about cytokine response. So it basically decreases that inflammatory response and to prevent, destruction or damage to the body. So anybody who has serious illness, their oxygenation is low, and or they are on a ventilator, or when they require oxygen, we give remdesivir and dexamethasone in combination. And both of them, as I alluded to earlier, the remdesivir, that medication was approved on the basis that reduces the duration of illness from 10 days to 5 days. And on the for the dexamethasone, the approval or the recommendation was based on decreased mortality a little bit compared to placebo, but nothing that really is going to make a huge difference. These are some things that we give, but there is no cure out there. I just want to underline that still, prevention is the best way to kind of survive this virus, this pandemic. Next slide. Also, recently, FDA issued emergency use authorization to a couple of monoclonal antibodies. One is produced by Moderna, and one is Lilly. Those are recommended in non-hospitalized patients. It's basically those who are at high risk for progressing into severe illness, for example, older age, above 55, 65, obese patients, diabetics, those who have immune suppression and the like. They are at risk for severe illness. They represent also the largest group that has, mortality, that has serious illness and mortality in the United States. So for those patients, after diagnosis within 3 days, if they are given these monoclonal antibodies that basically block the spike protein from attaching into the host cell and entering and causing the damage, this medication were found to, in phase 1 and 2 trials, reduce the number of people progressing to a serious illness among that group or requiring hospital admission. So that is the basis for FDA's granting emergency use authorization on these two drugs. As you remember, the president received these drugs from Regeneron. Next slide. So Dr. Danner talked a little bit about other supplements, but currently the FDA suggests that there is insufficient data to recommend either vitamin D, vitamin C, or zinc as a treatment for COVID. I think that is the last slide. I'll be happy to entertain any questions you may have.
Yes, Dr. Francois and Dr. Naidu, great presentations. And I'd like to start by, even just addressing two last things. And the one is the lack of data on things like immune enhancement drugs versus like synthetic drugs and antibodies. And, with say, for instance, like antibodies and certain synthetic drugs, a lot of money, a lot of research dollars goes into those kind of studies. So from the standpoint of practical recommendations, when we look at COVID-19, we look at the people who are not infected out of the hospital. We look at the people who are infected and out of the hospital. We have those people who are minimally infected that are in the hospital on the wards. And then there are people who are severely infected with decreased oxygenation and in the ICU. So in the population that either has not gotten an infection or who has an infection but has minimum symptoms, is there anything that you would recommend past, say, wearing a mask and practicing hand hygienes to help protect themselves to navigate in the face of a lack of good data?
So the current recommendation is basically what we call symptomatic treatment. Basically, if you have fever, you take antibiotics such as Tylenol or fever-reducing medication. It could be Motrin or the other over-the-counter drugs. Obviously, rest and like any viral illness, rest, adequate rest, eating, nutrition, fluids, all that is like you do for any illness, that should be helpful. But the problem is, as you mentioned, there is lack of data because this is early days. I mean, we know this disease has been around for 7 months, so down the line we don't know what the evidence is going to show, but currently there is just no data that other things, immune enhancers or the things that we mentioned, vitamins and all that, will be helpful in this case.
All right. So, Dr. Naidu, kind of piggybacking off of that, say, for instance, somebody, there's over and approaching 14 million people in the United States that have been infected, and, more than that worldwide. If I have had an infection and I haven't been formally diagnosed, but I'm pretty sure I had COVID-19, do I go and do I still need to be vaccinated? Or if I actually had a positive rapid test, if I had a positive COVID test, do I still need to be vaccinated? You're on mute, Dr. Naidu. You're on mute, Dr. Naidu.
All right, can everyone hear me?
Now we can.
Okay, all right, thank you. That was a great question. So I just want to be clear that the Advisory Committee on Immunizations Practice, ACIP, has not specifically made recommendations on, people who've been infected and, should they still get the vaccine. Those individuals were generally not included in the trials that have, that we have ongoing. There's the early guidance from the ACIP in terms of healthcare workers and elderly people, living in long-term care facilities. They did not include any information on whether you've been infected or not. So early guidance so far appears to suggest that they're not taking that into consideration. As you alluded to, there are people who get infected and don't may not necessarily know because their symptoms are extremely mild. And certainly there's no guidance to test everyone prior to getting the vaccine to know if they've had it or not before. So to answer your question in simple, so far there's no guidance on vaccines and people who've had it before. No formal guidance, but the early recommendations in terms of vaccinating healthcare workers and elderly people has not made any mention of whether they've had infection before or not.
Okay, excellent. There's a question from, I'll just read name Daryl, and he was saying, we were recommended earlier in the pandemic to take vitamin D, zinc, elderberry. Is that recommendation being reversed? I'll address that by saying that, the recommendation still stands. What Dr. Francois is saying that based on the NIH, we use evidence-based medicine to make recommendations, that there are no large, large randomized controlled studies using such an approach, but there is basic science, there's cohort data that does suggest it. And the issue is versus doing nothing, the treatment is a benign therapy that does help improve immunity in a lot of conditions. And so we have to use the best data in the face of a lack of data. There's something called the ANIA principle. And the ANIA principle says that absence of evidence isn't evidence of absence. So you don't always need studies, but studies would be better. And what Dr. Francois is saying is toward the end of this trial or toward the end of this pandemic, we may have more information, we may have more studies, and it may change recommendations based on that. But a lot of these things are ongoing. But the big focus right now is on primarily getting vaccines to try to protect the entire population, not only of the United States, but of the world. And in the midst of this, doing whatever you can. So, that being said, Dr. Francois, you talked a little bit about what how you treat people in the ICU. So that means you must be in the hospital treating patients individually. Let me ask you a simple question. Since the beginning of the pandemic to now, has anything changed as it relates to the demographic of patients who are presenting to the hospital? And Dr. Naidu, same to you. Who's getting admitted? Who's getting sick these days? Is it the same people that were first getting sick and dying at the beginning of the pandemic?
Yeah, good question. So the demography remains pretty much the same as far as I can see at Grady. Still, the majority of patients who are admitted have comorbidities or, obesity, elderly still. But what I want to highlight is even though this is not the largest group, we see young people being admitted for serious COVID illness. When I go out in the community, I see young folks particularly believing that they are invulnerable to this disease. They don't wear masks, they don't observe social distancing and the like. So we still don't understand really the factors why some people, some young people who don't have comorbidities are also, also suffer from or have a very serious illness. So it is to be on the safer side, really exercising all the cautions until you get a vaccine and until we know more about the disease is the best approach to follow.
Okay, Dr. Naidu.
I agree completely with Dr. Francois. I think comorbidities, elderly, um, young people are less likely to die. We've seen that from the data, but certainly a small number of them do get sick, and a small number of them have some lingering symptoms after they get sick. So important that we all take those precautions.
Okay, there's a question from online from I guess it says Redstream. It says only a small number of patients in the vaccine studies contracted COVID-19. What percentage of those patients were subjects of color, if any? Have we got
It's a
any
great,
of that data?
Yes, that's a great question. That data is not available just yet, and so I can't speak to that. Unfortunately, that data is not available.
So, if you're speaking to the listening audience, what would be your recommendation to people of color, to Black people in America as it relates to participating in vaccine related trials?
I would just want to say it is very important that we consider participating in these trials. Some of these trials have had to go through different mechanisms to try to get more of us involved. It is important because I think it adds more information overall on the safety and efficacy of these trials. We certainly want to have a diverse group to know that this works across all individuals. And so I think it is very important. And I know that all these pharmaceutical companies as well as academic institutions working with them have been making a lot of efforts to try to recruit uh, uh, people of color, African Americans, indigenous, Native Americans, Hispanic Americans. There's certainly been an effort to try to recruit more from these groups. And coincidentally, these groups are, we have taken the brunt in terms of deaths from COVID. And so I think it is important that we consider taking part.
Okay. All right. There's another question, and I will address this. It says, I've been told that hydrogen peroxide will kill COVID cells. Is that true? Well, COVID-19 is a virus. It's not actually a cell, it's a viral particle that affects in human cells. So, technically, no, it will not kill uh, viral or COVID cells because that's actually just saying an infected cell. What it can do is it kills a lot of times some certain bacteria, and that's why we use it on cuts. And alcohol has a tendency to actually kill the virus. So the current recommendation is Dr. Francois, Dr. Nadeau may have shown this well in his slides, but that 60% alcohol or greater in the hand sanitizer. That's why we use that because it kills viruses. So, Dr. Francois, so we're going to launch a program, say for instance, in January of vaccinating individuals. Is there going to be a cost? What if you're uninsured? How are you going to get these vaccines if after the people in the nursing home gets them in this next wave? And then
Um,
foster as well.
I'm not sure that has been worked out yet, but we hope that this is going to happen, that everybody who wants a vaccine will get it. This is not an individual issue. Obviously, if you don't achieve herd immunity in this country through vaccine or infection, you will never get rid of this virus. You will never open the economy. So we are in the same boat as far as this disease is concerned. It's not going to be an individual disease. One individual can start the pandemic, as you know. So I think the government will be well advised to pay for everybody who needs a vaccine, whether they are insured or not. That is my expectation and hope.
Yeah, I agree. I just wanted to kind of speak to that. Also, that the CDC um, has made a statement that vaccine will be provided free, the actual vaccine. Now, there a lot of facilities will assess nursing charges in terms of nursing administration and so forth. So that part will need to either be covered by insurance or by be it private or public. But the vaccine itself, which is usually the main cost associated with will is per CDC will be free to all those who want it.
Ms. Foster, did you have any thoughts?
That's my knowledge as well.
Okay, excellent. There's one question from one of our brothers from Savannah, Mr. Oglesby, asking, are each of us planning on receiving the vaccine? And I'll start by saying that yes, when it becomes available, yes, I would take the vaccine. I think that it's very important that we all participate in this based on our own individual level of comfort. It's hard to make a recommendation on what one individual should do specifically, but from a personal health risk standpoint, I think that it's important that when we get vaccinated for the reasons that have been espoused, but also from the standpoint of bringing this pandemic under control. In every trial, people have to participate in it, and the data, early data suggests that people who have participated, whether they received placebo or they actually received the vaccine, no one has had actually a severe outcome, which is very important. So that's supportive of following the data from the trial. And I like, there's an old saying, "In God we trust, everybody else bring data." So I want to thank Dr. Nadeau for sharing that information with us. But Dr. Nadeau, Dr. Francois, what's your thoughts?
Yeah.
Yes,
Yeah.
I will definitely take the vaccine when it's approved. I have confidence in the process that it has gone through, and I have confidence in the FDA regulatory process. Those are career scientists that have been doing this, evaluating. They're not politicians. They have been doing this, evaluating multiple things that have come through. So if and when they say this is ready to go, I will have full confidence in getting the vaccine. And I just to piggyback off Dr. Denier, I do believe that this pandemic is not really going to be controlled in the absence of a vaccine. I think we really need a vaccine. And so, yes, absolutely.
So I completely agree with that assessment. I can't actually wait to get a hand on this vaccine because I am tired of just not being able to travel. So this is really, I mean, we, as you probably know, as healthcare workers, we are required to take flu vaccine every year. Its efficacy is like 40-50% is, over 90% effective. So this is something really I look forward to taking. Yes, there are a little bit of side effect, but it's confined to like muscle aches and a little bit of fever. I don't see in the data, at least the preliminary data, anything that would cause serious side effects. So the benefit risk ratio heavily favors that this vaccine is safe and effective. So I will be first in line.
And so, and I think that's very important because I think that one of the challenges is, people buy from people they like. And so having people that you can relate to and giving advice and understanding that, yes, there is still more information that's needed, but there's enough information to say that we do think it's safe. We do think that, again, the integrity of the scientists that are doing this data is very, very high. And just to explain this just a little more from the standpoint of the type of vaccine, this is due to one of the molecules on the vaccine, the spike protein, rather than actually giving a live attenuated a weakened virus, as some viruses or some vaccines are produced in that manner. And so, again, we will learn more over time, but right now we think it is the best approach. And I think it's going to be a multimodal approach. So if we look at this and kind of stepping back and we had to give advice to someone who, I'll be honest, they're scared. They, again, some people are older. Some people still have muscle memory from things like the Tuskegee syphilis study and other trials that have happened. What word of encouragement do you have for that individual that's sitting out there saying, "Yeah, hey, I believe you, but yeah, I'm still scared." What do you tell them? How do you help them overcome those fears and legitimate concerns?
Yes, sir. Yes, sir. No, I think that's a phenomenal question. And first off, I do want to recognize that there are historic reasons why many in our communities are leery of healthcare in general, and are leery of the U.S. government in general. I do want to say that following the Tuskegee experiments, a number of safety measures are in place in terms of how clinical trials are conducted. And so if anyone were considering taking part in these trials, there are a number of safety things. Ultimately, a lot of information is given to anyone who is thinking about it. And ultimately, it's your decision as to whether or not, to proceed or not. And then just to kind of recap on what I said, these vaccines have gone through multiple steps of review, not just by authorities, but by us as scientists when the data is released in scientific journals. And ultimately, it's kind of come to this point where the FDA is looking at it. And the FDA actually will get all the data, analyze it themselves again to make sure that it's effective and it's safe. And just in the interest of time, I do see a question about England moving forward. I just want to say that England's process is a little bit different from ours. The question specifically was that England has already approved it. I don't have all the details of their approval process. I know Dr. Fauci made some comments that they don't delve into the data maybe as much as the FDA does. But I don't know their process. I know we have our process. Our process, as I'm sure theirs is basically to make sure that the data is reviewed by multiple people, not just by the scientists, the independent scientists, not just by the pharmaceutical companies, but the FDA is also going to do its own review as well, so that when it comes out, as a physician, I'm comfortable saying it's safe for you, it's effective for you, and I'll take it myself, when it comes out.
Dr. Francois, any last words?
The same. So basically, I just want to again emphasize vaccine or not, continuing the preventive measures, social distancing, and so on, because we don't know at this point, even if the vaccine is approved, how long it is going to be protective. So until we know for sure, how long it is going to work and all that, exercising cautions in terms of all the preventive measures we do, we should be, continuing to do that.
Excellent. Well, I want to end by saying I really want to thank you, gentlemen, and Ms. Foster for lending your expertise. I think it's very, very critical that we keep getting this kind of information out to the community. So on behalf of the 100 Black Men of America, Chairman Tommy Dortch and Dr. Mark Alexander, I really want to say thank you. And I want to also thank Eagle Force and my friend Stanley Campbell for this platform. It's called Mimi RX, which is powering our Healthcare 2.0 initiative. One of the things that's come out from the CDC is a card to now track which dose of medication you get, because that's going to become critical. Some of these doses require redosing, as Dr. Naidu shared. Writing down that information, having it available, not only what dose that you take, that you've actually been vaccinated, is going to be important as we continue to move through this pandemic. And this application, which is readily downloadable on your phone and smart devices, can be used today and is an active part of our Healthcare 2.0 initiative, not only for COVID-19 for surveillance, but for chronic disease management. So we encourage everyone to go out and download the app, but continue to seek information, continue to investigate and look into the resources like the ones Ms. Foster shared from Pfizer. It does give you access to a lot of other corporations and not just, that one entity. But we do want to, again, thank everybody who's out here working hard, all the healthcare workers and the government. Everybody's really doing a lot more than we really think. And so we want to applaud the efforts. And I'm going to pause right now, and I'm going to turn things back over to Dr. Mark Alexander. And I want to just thank all the panelists once again, and thank all the members who are participating in the Leadership Summit. It's been an honor and a pleasure. On that being said, Dr. Alexander.
Thank you, Dr. Danner. And I would like to echo your thanks to our scientists and our healers who are guiding us through this pandemic. We are all confident that brighter days will soon be here. We cannot let our guard down now, however. You must remain vigilant. You've got to avoid large crowds, and you've got to follow these strict procedures that our experts have put forward to us today. Naisha, I want to thank you so much for being an excellent partner. Pfizer's been a fantastic partner to the 100, and it is wonderful to know that there is access available to our members in the community who need support in getting these critical medications. So at this time, I do want to say that our National Health and Wellness Committee is going to be providing these updates periodically, and we're going to do this until we have defeated this virus. So look for announcements for these updates as we break new ground in ending the pandemic. We will look to these experts that we have today and others to help give us the information that we need to be successful. Now, I've been asked by our chairman of conventions and the meetings, Kevin Patterson, to announce that the President's Roundtable will be at 8 p.m. Eastern Time tonight, and that all chapter presidents should check their email for login information. Tomorrow's first workshop will be at 4 p.m. Eastern Time, and Dr. Joshua Murphy will lead our national mentoring training. So please encourage all of your members to register for this very important workshop. Our chairman has had some technical difficulties logging in, but he will be set up to greet you for the President's Roundtable and for the remaining workshops. So on behalf of Chairman Dorsch, the Board of Directors, and the leadership of our great organization, I want to thank you all for participating. And let's give all of our panelists a great big air applause. All right.
And Dr. Alexander, if I may, just remind you that there's the application at www.msm.edu/NCRN, the National Resiliency Network, and should be another valuable resource to help guide and navigate us through this pandemic. Thank you.
Absolutely. And let me, and I apologize for overlooking that, Dr. Danner. We are going to be hosting a webinar in January with the National COVID-19 Resilience Network and Morehouse School of Medicine. So be on the lookout for that. You're going to get a ton of great information, and you'll get lots of great resources that your chapters will need to combat COVID. Thank you very much.
Thank you, Mr. Foster. Thank you, Dr. Nadu. Thank you, Dr. Francois. And you guys, everybody have a great evening. Thank you. Thank you, Dr. Alexander.
Thanks.
Bye-bye.